Good evening. Welcome to Plymouth Medical and Valet Health's webinar on smarter growth in healthcare marketing this evening. My name is Joanne Tremblay. I'm the founder and CEO of Plymouth Medical, and I'm joined here tonight with Matty Crescenzo, who's also the founder and president of Valet Health, as well as one of my favorites, Dr. Christopher Rogers of San Diego Orthobiologics Medical Group. This evening, we will be discussing some very interesting topics and very sort of pertinent topics in this day and age of digital marketing. We're going to go over a lot of tips, some recent trends that we're seeing on the sort of orthobiologic digital marketing side. And we'll be really sort of generally talking about how to attract new patients and sort of convert those leads more efficiently for an orthobiologics provider. So I'm going to leave the floor to Matty to take us through his insights that he's sort of garnered over the years. Take it away, Matty.
Great, thanks, Joanne, and I appreciate Plymouth Medical having us and doing this webinar, and also Dr. Chris Rogers for joining us as well. So look forward to get rolling with this here. So I think overall, I think this to set the stage in the context initially, right? So we know patients and prospective patients are going on online with increasingly heightened consumer expectations, right? They're looking for the Amazon experience of convenience, and those expectations are carrying over even to physician practice websites and any really digital touch points they have throughout their online journey. But what you're going to see as we go through some of these insights and some of these trends on statistics, it's all going to tie back to data and ultimately marketing performance data. I thought this one was interesting here that the average cost, so this is a study from HubSpot, the average 2021 cost for a healthcare new patient lead across the US, this is across specialties, was $286. So as a frame of reference, right, first question should be, okay, is that high? Is that low? Is that good? Or is it not good? What we see in terms of efficiency for a cost to get a healthcare new lead, specifically in biologics, it should be under $100 to actually be between the $60 and $65 range when there are multiple channels to diversify how you attract new patients. And so we'll get into some of that, but I thought that was an interesting reference point that cost per lead is actually high. But stepping back, you should be looking at, okay, do I know my cost per lead, right, to get new patients in? So the most successful programs have multiple channels and diverse ways to attract and target and engage prospects and existing patients. So a multi-channel approach and an integrated approach is going to have everything from the overall online reputation of a clinic and a physician's, the accuracy of that data, which we're going to talk about across key health review sites such as WebMD and Vitals, and presence on Google, social media presence as well from Facebook, Instagram, to email campaigns, right, to prospects or to existing patients, to building organic visibility in Google search, and then to mobile campaigns and being visible across mobile devices and mobile retargeting campaigns, video campaigns. So regardless of the tactic and the mechanism to attract patients, it's going to ultimately tie back to, as you look at these levers, what are the efficient ways to get new patients in, but validating it with proof of return on investment in these areas. So as we referenced before, the efficient cost per lead and ultimately an efficient cost per acquisition is going to have multiple ways to bring in new patient opportunities. And so those are the most successful types of programs. And from a study looking at Google study in terms of how consumers search, and now this is across both paid search, pay-per-click, organic search, across all of Google's search properties. It's interesting here, and for health information, consumers look predominantly for where it hurts, right? Some symptoms, conditions, or diseases. So if you take the combination of that 38% on symptoms, 37% on conditions or diseases, that comprises 75%, right, of search. It's especially interesting that in biologics and regenerative, those are especially important to target and build campaigns around conditions, around the disease state, especially because in September of 2019, Google deemed anything under regenerative medicine as falling under their experimental speculative procedure policy, which means they will block any ads. So you can't run ads. So the way around it is to be able to build ad campaigns and target to where it hurts, right? So for example, knee arthritis and knee osteoarthritis has been something that we've seen with significant success. Probably the most successful campaigns across our clients are with Dr. Chris Rogers, who's on the webinar here, which he can attest to those campaigns. But really, when you look at it, as we looked at those different channels, you want to meet patients where they are and prospects where they are, and especially in their journey, they're first searching for, where does it hurt, right? Or if they're looking for a loved one's or a family member or friend, they're going to be researching some conditions and symptoms. So it's interesting because that also plays out on other channels too, such as WebMD. But when we get to ultimately the crux of it is, can you prove and can you quantify and measure marketing return on investment when you go direct to consumer and right to patients or right to prospects? This was an interesting study also from 2021, looking at the whole year. It's the State of Digital Marketing in Healthcare survey. And those that were in the leaders segment in this survey, it says 80% of the healthcare marketing executives in a leaders segment reported that they had a lack of tools, lack of infrastructure, expertise to properly measure marketing return on investment. As that's surprising, especially in a leaders category. So one of the things that I'm really happy that Chris, that you've joined the webinar here, because I'm here to tell you, and Chris will be here to attest to the fact that this is possible, because this is something through Valet Health that we've built out in our platform with data attribution, the ability to measure ROI and to have it be quantifiable. And it's something that Chris and I talked about early on, and we built out that capability in our platform. And so, Chris, let me turn it over to you
if I could just jump in and interrupt you for a moment. So first, let me just say, I'm in private practice in San Diego, and I was in a predominantly insurance-based practice for many years, almost 20 years prior to starting a virtually all cash practice, which I learned very quickly that I needed to market. And I'm an old guy and I'm old school. And so I really was not very knowledgeable in this space. And actually was unfortunate enough to work with 3 other digital marketing firms over the course of several years before finally meeting Matty and Valet Health, who turned out to be the perfect fit for our practice. Predominantly based on this key issue, I would ask each of these firms, show me the return on my investment. I'm writing checks for, all this money every month. What value am I getting? And Matty and his team were really the first company that were able to deliver. And so that's critically important, not just to demonstrate the value of the service that he's offering. And I will also add, it's more than just that. I'll elaborate later, but you'll find Matty to be extremely honest. It's rare to find such integrity in this field, and it's been a real pleasure working with him and his team. They absolutely are responsive and deliver on every promise ever made over the past several years. The first request I had was I wanted to know what my ROI is, and they spent a lot of effort to develop a streamlined system to deliver that metric every month. I'm a data guy. I know Matty's a data guy. I know Joanne is a data gal. We need data to not only make medical decisions, but we also need data to make business decisions. And so having that data is critical, and having it every month, having Matty actually go through it with us and review what it actually means. Where are we seeing the most bang for our investment buck? That says whether it's through Facebook or Yelp or Google or any of the other outlets that we look at, the other channels, also which campaigns are producing what kinds of results. So having that data boiled down and explained to us every month has been really helpful in making sure that we're being cost effective in our digital marketing. Just as a reference, I'm happy to say we average about 500% return on investment. So for every for every dollar I invest, I know I'm getting $6 back. And that's very helpful for knowing how much money we should be spending on digital marketing campaigns. We also get data on traffic to lead conversion, lead to close conversion. Those are helpful because then we can identify steps in the process where we might need to dial up or dial down. So I'm obviously here on the call tonight, not only because I think Matty and Joanne are great people and I love working with them, but also because they really have delivered on exactly what our practice needed.
Thanks, Dr. Rogers. I mean, from the Plymouth Medical's perspective, I feel we deal with so many different types of practices around the country, some focusing on MSK, some on more regenerative aesthetics. From our perspective, we just met with and sort of engaged with a lot of digital marketing companies over the years and never really committed to one, if that makes sense. We wanted to sort of really see how, whether there was actually ROI or not. And we put the Valet Health team to the test so we could actually speak intelligently and really confidently recommend them to our customer base. And not only did they sort of meet our expectations, but they went above and beyond and showed us where our own business could basically improve its digital presence. And that was really invaluable for us to sort of make some changes and clean things up online. I think online reputation has so much to do with the tangible things that we were able to implement to see some outcomes.
Yeah, I'll also validate what you just said, and given that I was in practice for 20 years in San Diego before I met Matty, I'd been at many different hospitals, many different organizations, many different practices, and my digital presence was all over the place. And so it made it very hard for patients to find me at the right location. And Matty and his team were really good at cleaning that up. Patients have no trouble finding me now. And I didn't really understand how important that was until after that was done.
I really appreciate both of you, Dr. Rogers and Joanne, and those comments. And I think one thing, and I'd be remiss if I didn't say that, the fact that the successful programs, it really takes us understanding the practice and feeling like we're woven into the practice, but also contributions on behalf of the physicians. So Dr. Rogers and his colleague, Dr. Reinbach, have always been fantastic with helping create content. And when we have ideas for campaigns, right, they'll do webinars, they will do Facebook Q&A, like Facebook Live. So there's always iteration based on the data of what was working more effectively. We do more of that. What was less effective, we did less of. So you can make data-driven decisions, but it does take, engagement and content contributions to be able to, again, reach more and meet consumers where they are. And so, I mean, Chris is a testament to that in his practice, being engaged and continuously creating content that brings value. And I think overall, the future of also where we're going is being able to make marketing claims based on evidence, based on patient outcomes. So with Data Biologics, which Plymouth Medical has supported from the very beginning before Valet Health has. But as I think about that now, Chris, did you want to make a couple comments about Data Biologics too? Because I think that's where we're going.
Appreciate the opportunity. Well, these are investigational treatments that we offer our patients, whether it's PRP or adipose-derived cells or now shockwave. And even though there's good support in the published literature, we really need to demonstrate to our patients that we can produce these results in our actual practice. And in addition, it's important, since these are investigational therapies, that we also need to track adverse events. That's something that doesn't really get talked about very much. And so we thought it was important to create a registry that would make it easy, because let's face it, doctors are busy. So we'll be able to input the patient in less than a minute, put in their medical information, the treatment they're receiving, and then create an automated method for encouraging patients to solicit patient-reported outcome data on a quarterly basis. And so I think we have more than 7,000 patients in our database now, and we're starting to see some really interesting patterns where PRP is more effective, where it's less effective. And that will those insights will just grow as time goes on, as more physicians contribute to that database. So it's just a hugely important thing that we track our patient outcomes. Patients need that information. We, frankly, as physicians, need that information. We share that with our network of, I think we're now 70 clinics. So we can raise the bar for everybody, see where best practices are occurring, see who's getting best outcomes. So sharing that data is hugely important. And as you mentioned, Joanne and Andrew and you, Matty, have all been extremely supportive of our efforts, and we're grateful for that. And we just really look forward to how data will help move this field forward in a responsible manner.
Excellent. Well, continuing on with talking about overall a digital program, the elements to success are foundationally shoring up physician and clinic information with accuracy of that data online from an online reputation perspective, the local business data listings associated with that, and then ultimately the technology that undergirds a digital program. So that's more than just the website. That's even technology such as CRM with automation capabilities that could bring text messaging or email automation capabilities to prospects or to existing patients. Those bottom three layers we call passive growth that undergird a full program that then leads to active growth. So when you're in active campaign mode, you're always looking to try to attract the right kind of traffic through different channels and continuously bring A/B test campaigns and bring different versions to see ultimately at the top what yields conversion. And conversion can be defined in various ways. So conversion can be one when a prospective or prospective patient sees an ad campaign, they go to a campaign page and they request an appointment online or they make a call. But really where the rubber meets the road is the conversion into new patient and a patient in the door. And that's ultimately, you need to answer that and have all these pieces linked together to ultimately know what ROI is. So if you were to say, what are the 5 layers of a whole program for digital that goes end to end, it would be what this hierarchy represents. And if we're to distill it to several pillars, at least in this discussion, we're going to spend more time going through some of the online reputation just because that's foundational. We'll talk about that. Then we'll touch on some items with analytics and some insights, and close with automation. So from an online reputation perspective, I think the biggest question is how much of your online presence do you control? So much that's out there, and you're about to see in the following slides, so much that's out there is inaccurate and also rogue and unclaimed, meaning nobody at the practice created profiles. They exist about location information, about physician information. From a sample size of 5,000 profiles in our system, providers and clinics, at baseline, 78% of that data was wrong when we do look for an exact match of physician information and where he or she practices. And so being able to have that cleaned up and shored up to be findable, as Chris, what you mentioned earlier, that continues to be such a significant issue for groups that don't have that data optimized just yet. And the reason why it is that way is because there are data aggregators out there and third-party sites that automatically spawn these profiles and list information about a physician and where physicians practice. And so that then gets picked up by all these different review sites. So it gets picked up from Google, and then in Google's knowledge graph, it'll pull in WebMD, it'll pull in health grades and vitals. So you could see how there could be a compounding effect of when there's the wrong information, which is why it's incredibly important to standardize and have a source of truth in one place to make sure that it is accurate. And so ultimately then any campaign activities you do digitally beyond that are going to bring prospective patients or existing patients to see the right information about a physician and where he or she practices. And so these are on high profile sites. When your online reputation is left to chance, there could be featured providers or doctors that are running ads on your name and on your practice. I'll give you a couple of examples of that coming up. but these are not on small traffic, not highly visited types of sites. WebMD is the #1 source of health information online. 1 out of every 4 adults in the United States use WebMD to self-diagnose, to look at information about conditions, treatments. Their numbers last year were over 1 billion in terms of traffic visits in the US. So there's no other health information site that's close to that. Yet what we come across consistently and continuously are, at baseline, this information, not only is it inaccurate, but it's unclaimed, and there's nobody at the practices that's managing it. Same thing on high traffic review sites like Vitals. And about a year and a half ago, WebMD actually acquired Vitals. So together they're sort of as part of one entity. So here's an example of WebMD profile when it's left to chance. And so you'll see ads that are running on it. It'll actually say, claim your profile. Yet there's 62 people, right? Look at this one, 62 people that left reviews on it. Nobody at the practice has control over it. And as you see here, it says featured provider near you. There is a competing physician running an ad on this profile. So there's also, right, there are physicians that are taking advantage from a market share perspective on others that are just leaving their online reputation to chance. So of course, the call to action here is to be able to take something that is a weakness and turn it into something that can be a strength and a new patient referral source. So here's an example of an optimized WebMD profile. It's specifically called an enhanced profile. This is something that's possible through our program with Launchpad. We're the only marketing technology in the country that has this relationship with WebMD, where we actually can have enhanced tracking on these profiles, where we can look at online appointment requests, we can look at phone calls that come in through call tracking, and then also properly and comprehensively reflect what a physician provides in terms of procedures, in terms of conditions. So if you think of, of the next thing in terms of biologics, or, Chris or Joanne, we talked about shockwave therapy. These are things that you can then associate to enhance profiles and create those categories or those procedures, and associate that metadata with the doctor and where he or she practices. Because then it's not only visible here, but as you can see, it's then visible in featured results. And Chris, I have you and Dr. Rambach here in the example. But if you look at regenerative medicine in WebMD in Carlsbad in your area, there are actually, it says 2,197 providers that have that in their profile. That doesn't mean they're all, a PM&R, or they're actually doing, doing regenerative, but it has it somewhere in their profile. But the enhanced profiles mean these are ads. So similar like Google ads that are running at the top of results, there's a rotation of ads inside of WebMD. This is what we mean of it being possible to have enhanced profiles, to have higher visibility that lead to new patient referrals. But you would only know that if you have the ability to quantify those leads, those calls, right? Those appointment requests. And so this is what we found is a viable, high converting lead generation source. Not the highest by volume, but on a percentage basis across all practices we work with, WebMD continues to perform exceptionally well at the highest conversion percentage of leads that come through. So that's a good example of one before, right, Chris? We were working together. You had, it would look like before, it was an unclaimed profile, same with Dr. Ambach, and then we turned it into something that is highly visible and reflective of what you do.
That's right.
I mean, it makes sense to what you were saying before, Matty. If a patient is actually searching, by symptom or where it hurts, and if they basically hone in on things like, regenerative medicine as, non-surgical options, this is exactly and precisely how those leads will sort of be generated. So it's good that you're able to quantify that.
Right. Meeting them where they are with what they're searching for. It could be a search related to, rotator cuff tear, that then they see an article on WebMD, they have featured doctors or doctor near me, and then there's visibility there, or they could be looking, more broadly by a category. And so this This actually here shows you from WebMD local market data. So actually, even before, when we look at baseline for any through Launchpad, through any physician profile, we actually have consumer level, zip code level data from WebMD and Vitals to see what's the local demand and interest in a specific zip code within 25-mile radius. But then from that point, when you then flip it into and convert it into an ad campaign, an enhanced profile, we could then look at visibility, overall searches, and activity on those profiles. But then the key from that point is how many calls, how many leads are generated, and tying that down to patient seen. So we'll talk about that in the analytics section of reporting to get to ROI. But this shows you a progression from initial data insights at baseline all the way through to visibility on WebMD to patient in the door. And when you can apply this same approach to any digital marketing tactic, to really to any marketing tactic or channel, then you have the data to make decisions of where you invest more dollars. So also in terms of from the reputation perspective, this just gives you an interesting trend line in terms of the overall traffic visit volume, audience reach. If you look at the big three in healthcare, WebMD, Vitals, Healthgrades for health information and also reviews, you'll see that you see the 84 million a month in this particular sampling. It was October 2020, September 2021. By far more than Healthgrades. Healthgrades is about 18.4 million per month, and Vitals at 4.1 million per month. And also device distribution, 65.5% of the traffic in that sampling at WebMD was mobile. So we've seen that over, you can imagine, right, of the last actually like 3-4 years, we've seen that flip from, mobile traffic was around 30 to 40%. Now, when we look at analytics on physician practice websites, we see 65 to 72% of the traffic is mobile. So then when you look at a website, right, you think, gosh, is it an accessible, modern, easy, simple user experience from a mobile device, or is it complicated with a ton of scrolling, right? So the mobile consideration is important on, as you could see, sites like this, but also applies to a physician practice website as well. Additional online reputation information too, like this, when Google business profiles or Google My Business left to chance, we see this stuff come up a lot too, right? A physician moves location, or they close down a location, says permanently closed, yet they still may be there, or that permanently closed is tied to the physician name, and somebody at the practice has no idea how to take control over it. So you'd be surprised at how often we come across this as well. And it applies to both clinic Google business profiles and to physician profiles. And so this is some of the low-hanging fruit that right out of the gates just have to be optimized for your one of the first things people are going to do is Google your name, right, as the practice or physician. So having all that shored up. Here's an example of one of Dr. Rogers, one of his colleagues, and one of our clients, and Plymouth Medical's clients as well, New Jersey Regenerative Institute, Dr. Malenga, with an optimized Google My Business listing and profile, building up review volumes, also having information that's accurate and reflective of the procedures that are offered, and review information, and even appointment landing pages that are tied to the physician specifically, to measure even inbound volume from that. So we can even look at how many people are calling in or making appointment requests through a Google My Business profile. And it's interesting to look at that data relative to WebMD, relative to other channels. So again, just hammering home that point of competing practices take advantage of your name. We see the same thing on Yelp. I know, Chris, you had mentioned that too earlier when we talked about that as part of ad campaigns, but it's the same thing too, where there are enhanced profiles, sponsored profiles, and ones that don't have that or that are unclaimed. Competitors can take advantage and take market share by running ads on it. And this is actually, you'd be surprised, like folks think, well, yeah, it's just restaurants or whatever, right? But in healthcare, in interventional pain, and as we've seen in regenerative as well, it's a viable tactic The only thing that is challenging, I would say, is that if there aren't really large practices, Yelp will allow you to do full data tracking from calls. For smaller practices, they actually restrict your ability to look at full caller ID numbers. So that's the only challenge from a data tracking perspective. That's just Yelp's policy. But the point being, you don't want to leave Yelp to chance, right? And have it be an unclaimed profile. Another thing we also see with competitors is running ads on a physician name, Google ads specifically, so paid search ads. We'll see that of running ads on a physician name or a brand, or chiros that are aggressive running ads on interventional pain or PM&R, regenerative physicians. So just continuously having a way to monitor and understand what's going on in the marketplace, which is very dynamic from a digital perspective. It's important to have that level of tracking and monitoring. And so again, so reputation's not left to chance. It's something where you can be proactive. And so what I referenced before is to shore up data accuracy and to be visible, where patients are. This is something that's possible through our Launchpad solution that also takes baseline error rates across a network of sites like we had talked about, including the health ones like WebMD and Vitals, quantifies it at baseline, and then we'll shore that up and ensure that it gets down to a 0% error rate. So if you're working right now with, for those who are listening and watching, if you're working with a group now that is claiming to manage all these things for you, just hold them accountable to your data accuracy, to your profiles, error rate, and just check all those different profiles, and including the main ones, such as WebMD and Vitals, Google, and Health Grades. Those are the big ones in terms of consumer volume. And so if you were to, you should also look at a grid or a table of what are your review volumes by these channels. So it's interesting that we see such variance with going by to different practices and with physicians, where you'll see some that have incredibly high Google reviews, or maybe really high WebMD reviews, and then some very low, like low Health Grades reviews. So you want to have as much balance as possible across those review sites, and have a simple way to do like a quick pulse survey, scan a QR code that has a picture of a physician, get a quick single question survey, and help capture those reviews and have that part of your practice workflow. So
I'll just add that that's something that I've always struggled with, is soliciting testimonials from patients. I don't know, it's just not in my blood to do that, but made it really easy to just have a little piece of paper, says, thank you very much for your review. And it's got the QR code, and we've trained our staff. If someone said, we hear good things all the time, patients telling us how happy they are. And they're like, oh, great. Would you be willing to scan this and put in a positive reading? That's really helped make my job easier to solicit testimonials.
Thank you, Chris. Yeah. I think another point too about when we have patients with a positive experience is then if we take it to the next level, then turning those into full-blown patient success stories, right? That then you can, build out on the blog. Like I think of some of the ones, we did, Chris, with you have the golfer testimonials and different things like that, where there are larger stories. What's important about that is that then you can associate what the patient had, what the patient came in for treatment for, then the biologic or cell-based therapy or treatment solution, and then geographically optimize that. So when people are looking in the local area, right, they're going to see a success story as one of the first things they're going to see, right? And then if they come across that, they go, oh, wow, that's a patient like me, or I know somebody, so you could take it to the next level. We're talking about just reviews here, which is essential, but taking it to the next level where you can amplify the visibility of those success stories is part of a multi-channel approach like we were talking about. So to summarize the reputation, like a takeaway or action item would be, your first tip would be to ask the digital support company to quantify your baseline error rate on your profiles, especially across your big four sites: WebMD, Google, Vitals, Health Grades. And then the second point would be ask the time frame to achieve the business result. What's your pre and post in terms of where is it at baseline? How quickly can it get cleaned up? what happens on an ongoing basis from a measurement standpoint and from a data and a tracking perspective. So getting into analytics, which can be a very dense and deep subject, we're going to keep it high level from the standpoint of having something that's actionable, right? So the question here is, do you have accurate and consistent insights for all three of these metrics in a growth funnel, right? So any activities you do to build awareness or education in the community or attract potential patients, it's going to go through the top. We call that top of the funnel. The first metric is how many new users are you reaching month over month? Then the second part of that step is when they then convert or reach out for information through appointment request or a call, how many leads are being generated? That's the second metric. And then the third one is being able to say, okay, how many new patients came in from that lead sampling? And that's the critical one. So having accurate and consistent insights for all three metrics is critical to being able to measure cost per acquisition and ROI. And the way that we do that at Valley Health and through our attribution system is we'll tie it back to a phone number. So we'll get all new patients that come in to the practice, just phone number, and we'll do a data reconciliation match of every lead that's generated across all the sources. And since we have tracking on every source, we'll know exactly what came in by channel. So that's ultimately what's going to give you this view of, one, you'll know, okay, here's my cost per acquisition. Here's my ROI in aggregate. And then you can see the breakdown by channel as well. But these are based on patients that came in the door. And that's the critical piece of it, which typically is the missing part, right? So those are substantive growth metrics that you want to ask any provider you have or a digital marketing company if that level of data is being provided. And if it's not, ask them how they can provide it and work with your practice to get that data. So if you take this, for example, if you said, okay, for biologics or certain cell-based therapies, cash pay, it's going to be, let's say, $1,500 or $2,000. If you knew your cost per acquisition was $338 to get a patient that's $2,000, you're going to do that all day long, right? So then it's a matter of what are the tactics and mix of campaigns that will yield that kind of efficiency, and then you keep pushing and building and expanding those campaigns to give you that efficiency, and ultimately that's what yields what Chris talked about with his program at a 500% ROI. That kind of efficiency is yielded by continuously iterating based on the data, but seeing that it delivers a positive return and doing more of the things that are effective and less of the things that aren't.
And I'll just add, to get that data, it requires Matty to work closely with our team, with our staff, and because we have the financial data, right? We know what we're generating, and when he matches those up with where the leads are coming from, that's where we really get these finely tuned, dialed in insights that help us make these decisions that we need to make. And so the point of emphasizing is, again, I indicated earlier, I've worked with 3 prior companies, digital marketing companies. None of them were even close to being as collaborative with our practice. And it was critical. That was critical that Matty did that so that we could get these insights.
Prior to working with Valet, Dr. Rogers, were you even aware of your cost per acquisition, let alone your ROI?
Prior?
Yes.
No. Oh, clueless. All I know is I was writing checks every month, and the company claimed were doing something, and the communication was not good. And it was a frustrating experience. I imagine some of the physicians who are listening tonight maybe are having similar experience. So I'm just emphasizing that I've seen what good looks like, and I've seen what not good looks like. And so just like I say, from top down, from the high level integrity, high level of commitment to getting data-driven digital marketing campaigns, working with us. Matty's educated me tremendously. Again, I'm an old guy, I didn't understand marketing at all. And it really educated me on the whole process. And it just allows us to function more intelligently.
And I think also, Chris, there's having the collaboration you're talking about, there's the feedback loop that's so important to give back to our team, is that when your staff when you're working leads and the ones that don't convert, we also want to understand what are those dispositions, what are maybe those reasons they don't convert. Joanne, we were talking about that too, right? The importance of helping staff at the physician practice level, from a training perspective to go by certain scripts and talking points to be able to convert these new patient opportunities. It just so happens, Chris, and at his practice, he has excellent staff with experience that know how to handle and work new patient leads. I mean, I could tell you that is not what we typically come across, is in terms of the ability to be able to manage those. So I think it's so important to have that, to have a feedback loop, so they could then give data back to a digital marketing team, right? To do the things that are more effective, but based on what they're seeing and operating and working with those leads. Like we even give access to all the call recordings of the leads that come through, right? So that's important for quality control for somebody at the practice level to listen through that, which we can listen to those as well. And but I think that collaboration is really important, because typically it's when there's the disconnect, when operations and marketing and there's a disconnect, that's typically when it's a black box, right? Just Chris, like you were saying.
Absolutely. I mean, we hear this all the time. It's feedback that we hear all the time. I mean, our physicians are frustrated because they have the best training. They've gone through the trouble of going the extra mile and not grabbing something off the shelf and injecting their patient. They've gone the extra mile. They've made the investment, and ultimately, at the end of the day, everything that they've spent on their marketing is just completely nebulous and it is very difficult to quantify. And at the same time, all these leads are generated because of their reputation overall. And there's kind of you're just as strong as your weakest link, right? So if you have a patient have a bad experience when they are calling for more information, you can have the glossiest, most beautiful brochure that you get from Plymouth Medical and a great poster in your waiting room. But at the end of the day, ultimately, if those questions aren't answered effectively on a phone call when a patient's asking for more information, that's completely gone to waste. All of that effort and all of those resources gone to waste. So, I think as a team, Plymouth Medical and Valet can really kind of shore up that overall sort of patient journey, because patients are interested in knowing more. They want to dive into the science. They want to understand what their outcomes are going to be, and they sort of obviously deserve to get that data, and they deserve to have their questions answered succinctly and effectively, so that you can so the physicians can actually just focus on what they do best, and that is treating patients. So
and I'll just add also, the physician perspective about what is good marketing, what is bad marketing is often wrong. Go to any doctor in your town's website, and it's very likely they're going to just list all the things they do, particularly if it's a pain management website. They're going to say, we do epidurals and we do, stellate ganglion blocks, and they'll list all the procedures. And that is, I think, the wrong approach. I use the analogy, if I have a leaky faucet, I don't care what kind of wrench my plumber uses or what fancy new technique they use to diagnose it, as long as they're good at fixing that leak. And I think patients think the same thing, which is what your earlier data spoke to. Patients are seeking solutions to symptoms and specific conditions.
Right. Conditions. Yep. Mm-hmm.
And so that kind of flipped my whole idea. So even though we have information on our website about what the procedures are and we can educate them on that, really it's, again, what Joanne was talking about before, the patient journey. The patient journey starts with them seeking an answer to a question. And we need to understand their question. The other thing that you've done for us, Matty, is you'll do these A/B, what you call A/B testing, where Dr. Rogers thinks he knows what people are looking for, but maybe we put it a different way. So I think they're looking for PRP for their knee, but maybe what they're looking for is a solution for their knee arthritis. And so we'll put out different ad campaigns, and then we'll see which one actually produces the result that we're looking for. So it's a much smarter way to go about spending your.
Right. It's taking in, right. It's take that A/B testing is taking in the voice of the patient, right? And they're saying, hey, here's what works for me, because we're seeing what they respond to more. And then, so when we have a version, that's a good point. We have a version of an ad or of a campaign page that generates more leads. Then you have that as your winner of a period of time where we run that. Like, so the systems tell you statistical significance. And then what you then do is introduce a challenging variation of that. So for example, you may change a video, you may change a page layout. And what you're always doing is trying to optimize or iterate to get to a version that performs better. And I think that's right. That's the antithesis of a static approach, right? It's something where you're continuously trying to improve. And anything where you can apply that in business, right, where there's continuous improvement, you're always testing based on data. Like that's exactly what this kind of approach is in digital that we're talking about that gets to ROI. So to summarize that whole section on analytics and ROI, I think that the key tips here are, one, you need to be able to know what your overall digital marketing, your program ROI is, but ask a digital support company if they can provide you with like clear answers in specific date ranges, the cost per lead, the cost per acquisition, and ROI. And some are going to be able to very quickly get a cost per lead number to you, but the cost per acquisition, the ROI, is going to be the challenging part. And that's the information you're going to need to be successful. The second tip would be, what would the further detail that you could ask them on, well, how is your tracking set up? What does the data visualization look like? How is that displayed back to me at an executive level, so I can know I could quickly spot and see, is this effective, or is our program effective? And what do the numbers look like month over month? Is it trending in a positive direction, or is it not? And then ultimately, who does the analysis? Is it something that's a DIY where you're going to be looking at reports or you're not sure what you're looking at and having to figure it out or analyze it? Or do you get insights fed to you and then say, okay, based on what we see, now here's what we're going to do about it. So you want that, ideally, a do it for me, right? Where you have the analysis done and it's a proactive approach that then says, now here's what we're going to do in this next month and make decisions. And so that then ties into the collaboration piece, Chris, that you were talking about, that when you look at it that way, month over month, then you not only iterate, you innovate, and you think of better ways to reach patients, right? And messaging that you're testing that's more effective to meet them where they are and to reach them and for it to resonate with them.
And I'll also add the way you manage this process. Not only am I aware of how my money is being spent on marketing, but also it's time efficient. I mean, we'll do like a half hour, 45-minute tops a month. You've already got the data crunched, so we can just go through it quickly and then make very quick decisions about what to do for the next month going forward. And time, yeah.
From the sort of the data analysis that Valet Health was able to provide just our company at Plymouth Medical, I think every single minute of my day is already accounted for. So there's nothing that is left, to chance. So, in those calls, I just found that was like the fastest, most efficient way to really kind of hone in on, what we should be doing and what campaigns we should be focused on, and what our physicians who are ultimately our sort of patients were kind of looking to hear from us. So that was just invaluable to sort of cut to the chase and get to what was actually working.
Awesome. And the last piece, and there's actually only one slide on this one where we talk about automation. This is more of a look to the future of where we're going with things. So in terms of Valet Health, we're building out, and we have built out an offering for targeted and patient education automation. So this is behavior-based. So it's going to send different messages via text to people, and based on their engagement, it'll send them down different sequences. So this is something that we're talking about for innovative therapies that Chris, I appreciate you collaborating on some of the things that we've discussed that we'll be able to announce. And then also Joanne, of course, with Plymouth, some of the things that we're discussing in terms of bringing procedure or tying that to specific condition is something that is there's a move in this direction of being able to have marketing automation and typically marketing automation at the level that we're talking about here that's behavior based. This is something that's done more at enterprise level and really large organizations with data scientists and analytics teams. We're talking about an application here that works for an independent physician practice if it's less than 3 physicians, something that will identify potential candidates by ICD-10 codes that will help bring in specific types of patients for therapies that are innovative and that have outcomes to validate their effectiveness. So this is more just a look to the future of where we're going. It's something we're going to be announcing here actually in Q1. Any other thoughts on that, Joanne or Chris? Feel free to.
Yeah, actually, I mean, this whole idea of ICD-10 codes is, some advice that we have given our clients over the last 10 years to say, you've got the right product now, you've got the right training. Their next question was, well, how am I going to track patients? And really, it starts from within your network. You already have, especially if you come from a sort of a reimbursement model or you have a hybrid clinic, there are patients in your sort of EMR system that are just begging to learn about what you do and about the sort of the new cellular therapies that you're offering and the sort of related outcomes. So again, we get sort of caught in, running a clinic and things get busy and people get distracted, but the data is there in your EMR system. So historically, we would have basically tasked someone within the organization to pull those ICD-10 codes and see whether we could sort of build an email marketing. But this is going to be, more in keeping, more contemporary with, patients and how savvy they are and sort of shopping for healthcare services online. More and more, I mean, I can speak for myself. When I'm shopping for things online, I want access to, the data that these types of workflows or platforms can actually give me access to, so I can make the better decisions quicker. So I think I'm very excited about this.
I'm excited about it too. Obviously patient education is at the core of what it means to be a physician, to help your patient make informed medical decisions. Now with the advent of regenerative medicine, there are so many choices for the patient to assimilate. All of us, well, hopefully you younger folks haven't, but all of us older folks have been a patient at one time or another. And when you're in the doctor's office, you're trying to take in as much information as possible. It's nice having other resources that you can then go look at and just get further educated to help you make that decision at your leisure. This is also something, it helps the patient, also helps the doctor if the patient is now more comfortable understanding what it is that the doctor is recommending, because now they have this extra information. It just makes it more likely that they're going to want to comply with the recommendations that you're giving them. I think we'll track that and see if that's true, but I think it is true. And the field of regenerative medicine is growing ever so quickly. There's more devices and products and treatments, coming on the market all the time. So patients and physicians alike are overwhelmed. So just having a place where they can come and look at these options, I think is going to be really helpful for them going forward. And
remind them as well. I mean, we all get busy. I've got 52 different pages open on my mobile now of things that I need to do. And they're open just so I can remind myself to do it. But, with sort of intelligent and not annoying, but intelligent sort of automation, I think, from a marketing perspective, it's going to really help a lot of our clients sort of capture those treatments and basically keep those patients in the practice for a long time.
Absolutely. So yeah, in summary, what I would love to offer here is if you guys go to connect.valethealth.com/Plymouth Medical, Plymouth-Medical, What you'll see here is that we're offering a baseline report card analysis. So we'll actually give you data on your physician, your location or locations. So if you just go to this, we'll actually provide these slides as well, but this link, I know that Plymouth Medical will provide this link as well. It's also in the slides. But we would love to be able to bring value to share data. In the first conversation that we have will be something we can discuss substance and data from the very get-go that we could provide for you. So we appreciate everybody's attention today and for joining or watching this playback. If you end up watching it later, thank you so much, Joanne and Chris, for this. It's awesome to be able to do this with you in any way we can serve and bring value for other initiatives. Always let us know at Valley Health. We're so thankful to be a part and working with you both.
Thank you.
Thanks, Matty. Thanks, Dr. Rogers, for your time. And again, if you want access and more insights on your own sort of current online presence, feel free to put your hand up, schedule a consultation with us on this link, and we'll provide you with this report card and see how good you fare. So, and again, Happy New Year, everyone. Hopefully 2022 is a good one for all of us.